Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about infant mortality, and joining me is Linda Thomas, the Director of the Office of Minority Affairs for the Oklahoma State Department of Health. Welcome to the program.
Thank you. Glad to be here today.
Well, thank you very much. Now, before we start, actually, I want you to tell us a little bit about this. We'll throw a wrench in it a little bit about the Office of Minority Health, because people may not really know what that's all about.
Okay. The Office of Minority Health is housed in the Oklahoma State Department of Health. We've been existing since 1994, and we provide services for interpreters and translators for limited English proficiency clients who have problems understanding English, or they may have limited to no English skills. So we provide those services. We do translation of documents. We interpret over the phone as well as in person. We provide we do a couple of initiatives. We do a community health chat, which is a chat where we invite the community to come in and we talk about our health concerns, and it's all across the board. It could be cardiovascular, it could be cancer, it could be any health concerns that they have, and so we prioritize those health concerns and we discuss them, and we come up with not only problems but solutions to whatever health concerns we come up with. So that's a kind of a period of time. Okay. So we have several chats to come up with the solutions for whatever problems that we uncover. Our office is for racial ethnic minorities, and that's for Hispanics, African Americans, Native Americans, Asians. So it runs the gamut, but we do look at racial ethnic disparities across the board. We also have a program called Body and Soul, and the Body and Soul program is for African American churches, where we're trying to raise awareness of obesity issues within the church. And so we are looking at funding for churches across the state to promote the program and to conduct the program within their churches, their faith organizations.
Okay, now when you talked about the initiative with the chats, do you do this throughout the state, going into various communities so that you kind of are traveling throughout the state?
Yes, our office is a state office, and so our territory is the whole state of Oklahoma. We have these chats all over the state, and so we had one in August in Ardmore, and so that was the last one we had, but we are scheduling them across the state. We also have an initiative for infant mortality, which is what we're going to talk about today, a little bit about our Healthy Baby Begins With You, which is a community baby shower to raise awareness of infant mortality.
Okay.
And then there are other initiatives that we do. We do, let me see. The other initiatives that we do, I'm trying to think.
Well, that's okay. While you're thinking, I do have a question for you. With the chats, like you said, you do them throughout the state. Can people in various communities call you and ask you to come into their community for a chat? Does it work that way?
Yes, it does. We, no matter what community that we're going in, we do a press release from the State Health Department announcing, and it's in all local community newspapers, announcing the fact that we are having a chat, and that you're invited to give your input whether or not you can make it personally or not. Because we do understand that sometimes people want to give information, but they can't. And so we allow them a time period for them to, a response period, for them to respond with questions and comments. And then we take that information to the chat, then along with the information that we gather. We discuss that, and then we give them a response based on the information we receive from the chat.
Okay, and I will put up information about how people can get in touch with you at the end of the program.
Okay.
Because that's a good thing, where people can actually contact you and provide input or ask you to come out to their area if you're not already scheduled to do that. The other thing I want to ask before we swing into infant mortality is, you talked about your other initiative with obesity and in the churches. Some people may wonder, do you look at other faith-based organizations in terms of maybe going into synagogues or other kinds of places, or is it just mainly the church focus?
Right now, because our Body and Soul program is a pilot, we've never done this program before in the state of Oklahoma. So this is our first year, and this is the first time we've ever piloted the program. And so because obesity rates are so high in African Americans, and mainly they have churches, So we've decided to just try to look at those churches. But when we release a RFP, a request for a proposal, anyone can respond.
Okay.
But we're mainly targeting African Americans, and only so that we can look at just a pilot, a core group of people, to see whether or not the initiative works, and if we need to tweak anything, if there's anything that needs to be changed. Because as I stated, this is a pilot, and this is the first time we've ever done it before.
Okay, which makes sense, because with pilots you do try to target one of the higher risk areas, and then you know how to expand out from there.
Yeah.
Good initiatives.
Thank
well,
you.
infant mortality. Tell me a little bit, and our viewers, a little bit about infant mortality within the state of Oklahoma. What does it look like?
Infant mortality in the state of Oklahoma. Oklahoma is one of the highest states with infant mortality. It really looks like it's within African American communities. African Americans are almost three times as prevalent of getting infant mortality than other communities. Currently, their rates are 20.1%, and so that's almost triple the national average, which is 8.0%.
Okay.
And so for Native Americans, it's 9.6, and for Hispanics, it's 6.7. And most of our other communities really do not have the problem that African Americans have with infant mortality.
When you're saying that, then what are some of the causative factors that are making it so high within the African American community compared to others?
Research is being done on various factors that may impact African Americans for infant mortality. Some people say it's stress. Some researchers say it's not getting prenatal care. But when you look at all the causative factors, African Americans are still at risk, and it's not necessarily genetic. So researchers are looking into why is this a factor, because we're seeing across all income economic levels that you're still at risk for infant mortality, and you're more at risk if you're pregnant with multiples, if you've had a preterm baby before, if you're not taking care of yourself physically and mentally. Stress is a large factor, and we're not sure how stress plays a part, but we know that it does.
Okay, now when we talk then about infant mortality, let's sort of clarify for viewers exactly what you're saying. Are you talking about the death of a fetus where they're not born, they're still born, or they die shortly after birth? Exactly what is infant mortality?
It's a baby that dies before its first birthday.
Okay.
In the first year of life.
Okay, and that's 20%
for African Americans.
For African Americans within the state of Oklahoma alone.
In the state of Oklahoma. Within this whole state of Oklahoma.
That's incredible. Now, are there some, just in general, are there some communities that tend to be higher impact than others?
Well, when you have a larger majority of African Americans within that, like Oklahoma City, Tulsa, Lawton, those areas, because they have a larger concentration of African Americans, then you would have a higher infant mortality rate. So, and we have to understand that for the state of Oklahoma, African Americans are only like 8%, approximately 8% of this population. So when you look at the infant mortality rate being 20.1, think about that. Double would be 16.
Right.
Triple is 24. So we're moving to the continuum of being 24, 3 times as high. So we have to start looking at initiatives to address not only taking care of yourself before pregnancy, taking care of yourself during pregnancy, and taking care of yourself after pregnancy.
Okay.
Because if you're not healthy, you're more inclined to have a baby that doesn't make it the first year of life.
Okay. Well, we're going to take a really quick break and come back and pick up on some other things we need to know about infant mortality.
Okay.
Okay. Please stay with us. We'll be right back.
Learning how to kickflip 6 stairs takes determination. So will getting into college. I've got what it takes. So do you.
Welcome back. To continue our discussion on infant mortality, joining me again is Linda Thomas, Director of the Office of Minority Health for the Oklahoma State Department of Health. Let's jump in.
Okay.
Now, we were talking about this great disparity between the African American community in infant mortality compared to other communities, ethnic communities. Let's look a little bit more about specific factors to kind of see how they can be sort of related to this and how people can tend to overcome it if we're trying to sort of attack that. Let me ask you this one thing in terms of what research has shown. Nutrition. Sometimes there may be unhealthy diets that are going on. Does that tend to impact the mortality rate more significantly with African Americans if you've got high blood pressure issues because of how maybe you're eating? Although there are other factors to high blood pressure, but let's just talk about the one that could be nutritional focused. Diabetes, you know, all of those kinds of things. Are those things that are impacting this?
Yes, diabetes impact preterm births, obesity, not taking care of yourself, not really knowing the proper diet that you need to have before pregnancy, and becoming pregnant when you're already, you know, overweight, but not just overweight, but obese. That creates a problem with preterm births as well. Diabetes, high blood pressure, infections, all of those conditions contribute to having a preterm baby. And so once again, it's important to really take care of you. So if you're planning, and we know when I say if you're planning, we know most pregnancy are oops. Okay. Most of them are not planned.
Okay.
But if you're thinking about getting pregnant, then we would ask that you take some folic acid, 4 micrograms of folic acid, so that your body will start getting used to it and building up immunity, so that you will, you know, have a less chance of having a preterm birth or low birth weight baby, or, you know, baby just dying before, you know, the first year of life. And so it's important, you know, that if you are diabetic, that you learn how to manage your diabetes, that you are seeking medical care, and that the doctor is following you throughout your pregnancy. But that's not only for diabetes. If you are overweight,
the same thing.
The same thing is to know that, okay, I need to try to get myself to lose some weight so that I can be more at a healthier weight, because when you're pregnant, then you're going to gain some weight. Most people do gain weight. And so you want to make sure that your body is in the optimal condition in order to hold and house a baby. Okay,
and the thing too with nutrition, if you're able to get a nutritional assessment to kind of see how you are, because you may find that you're deficient in certain types of amino acids, or iron level may be low, or different things like that. So you can, like you're saying, actually build your body up to prepare for a baby and carrying a baby to term, and the kinds of nutritional needs they're going to need that you're going to have to be the source for, in terms of your intake and vitamins and supplements and all that. So the medical home is a very important kind of phenomenon, is it not, in terms of being followed and getting the advice you need and being closely monitored?
Most people do not understand the importance of having a medical home, having a doctor who, upon intake, your first trimester, is following you throughout pregnancy, so that if in case there's any complications at all, they'll be able to follow you and be able to address those complications. If you don't have a medical home and you're going to the emergency room, or you're going to different places, then your records are at different places. And so if you encounter a problem, then they're not going to know when the problem began or what the other doctor has done to treat the problem. And so it's important that when we think about taking care of ourselves, it's the whole gamut. Economics, not having a job, having a low-paying job, all those are stressors, and they magnify, multiply when you're pregnant, because you're trying to figure out what you're going to do now, what you're going to do next when the baby comes, and you're trying to put those safety nets into place. And sometimes that's difficult. Having a medical home, you should just make a checklist of things that you need in order to have a healthy baby.
Okay, now are there support systems out there for people who may struggle economically that help provide additional food assistance? I mean, we know about food stamps and things such as that, but are there places that you can go? Let's say you can't, because some people may say, I can't afford a doctor. So are there resources that you can help them sort of maybe locate that provide that kind of care that's very reasonable, free, or minimal charge?
Yes, thank you. I'm glad you asked. Thank you. We do have a listing of free and low cost and no cost clinics. And we have a resource list from our office that we provide to individuals who, when we have our community baby showers, when we have our community health chats, whatever outreach efforts we're doing, we make sure to bring that document so that people will know if they're having problems with food, because food pantries are on there, low cost, no cost clinics are on there.
Okay.
And you know, right now we have a lot of churches that are providing free health care. And so people really need to know where those services are located, because you may be able to, some people are within that small catchment area where you make too much money to qualify for social supports, but you don't make enough money to really live on a level that you need to live, to pay for your health care, to buy the types of food. Because if we think about it, I mean, I'm just saying, think about it for a minute. Being healthy costs.
It does. It does.
It's cheaper to be obese, but being healthy costs.
It does, because a lot of the food selections in vegetables and fruits and fresh vegetables and those things do cost more. The no salt added vegetables in the can, they even cost more. So you're right. Let me ask you this question then, when we're looking at this infant mortality. How does teenage pregnancy impact the mortality rate? Is it higher, tends to be higher among teens who are having babies or pregnant, or does it tend to be about the same no matter what the age of the woman is?
It depends. So it's dependent on several factors. But when we're looking at infant mortality, we're looking at it as a group. We're looking at it for women of childbearing age 15 to 44.
Okay.
And so when we look at it that way, we see that across the board, no matter how much money you make, what type of job you have, you're more at risk for infant mortality. You know, it's startling that research has been shown that a woman with an advanced degree is more at risk for infant mortality than a Caucasian female who has just graduated from high school. Is
that because of some disparities in how people in the healthcare system will respond to their needs?
It is not just the disparities in the healthcare system. It's a multitude of issues. It's not just going and getting prenatal care, because they would go and get the same prenatal care. It is even following the advice of your doctor. But just research is being shown that through stressors, doing different factors, cultural norms, those types of things, environmental factors. Okay. There have been a lot of people who you would not normally think would be at risk for infant mortality is at risk for infant mortality.
Okay, so it may be, like, say, some of the stresses they're encountering because of the cultural background that they have that might be aggravating that. Okay, we're going to take a quick break, but with the teens, since they don't have a job, they probably are more at risk because they want to also sometimes even deny they're pregnant. And that's a big problem.
Oh, that's a big thing, because they don't go in their first trimester.
Right.
Because they're trying to hide, some of them hide their pregnancy. So, you know.
Well, we're going to take a quick break and come back and talk about some initiatives that you have to try to help us with that.
Okay, great.
Please stay with us. We'll be right back.
Turning a 20-foot wall into a canvas takes vision. So will getting into college. I've got what it takes. So do you.
Welcome back. To complete our discussion on infant mortality, joining me again is Linda Thomas. She's the Director of the Office of Minority Health for the Oklahoma State Department of Health. Let's jump in. Now, in our other segments, we talked about infant mortality and kind of some of the factors and the discrepancies in the different ethnic communities. Let's focus this segment on initiatives. What do you have in the Office of Minority Health at the state level that helps people sort of become aware of this and actually start to maybe change the dynamics that are happening?
Okay. In 2009, the Office of Minority Health decided to pilot a community baby shower.
Okay.
We piloted it in Oklahoma City, and we had an overwhelming response. And so after that response, we decided to develop a toolkit. And so this is a toolkit that we've developed based on A Healthy Baby Begins With You.
We can kind of see that. Healthy Baby Begins With You.
Okay. And so we have educational community baby showers all across the state. And if anyone is interested in having a shower, they can just contact our office. Okay. We partner with anyone within our community who would like to be a partner to raise awareness of infant mortality. We have a physician there who gives factual information on having a healthy baby, well child care, taking care of yourself before, during, and after pregnancy. We have community vendors who are there as well, and they talk a little bit about the services they provide to mothers. The community baby showers are not only open to women who are pregnant, they're open to women who are thinking about becoming pregnant. They're open to foster parents, grandparents taking care of children under the age of 2, fathers, and it's amazing how much community outpouring, how much support we've been able to have with the community baby showers.
So really it sounds like it's a resource information kind of support group effort. It's kind of like all of that wrapped up into one.
Yes.
Okay, which is really different and unique because, like you said, you can be the male in the person's life, or maybe the two are planning to have a baby and they want to come and get information. The person who's also pregnant, the grandparents. Can siblings come if they are? Is there something for them to understand how to work with this new baby that's going to come into their home?
We have children that are siblings who are able to participate in the shower as well. And we also have a segment for the doctor to talk a little bit about male health as well while they're in the shower. The beauty and the fun of the community baby shower is that it's just a relaxing environment. It's non-threatening. It is an environment where if you have a question and you don't feel comfortable asking a question, all you do is write your question down, and we have runners who will take your question to the doctor. And so you still remain anonymous while your question is being answered. And so, but it's the fact that most women of color are not able to sit in a classroom setting just based on the time that they have to give.
Okay.
Okay, so, and so while you're still able to learn, it is not a strict classroom setting. It's an environment where everything is about you becoming a mother, you as a mother. And for the grandparents, we even have a section where the grandparents dispel myths about pregnancy. Okay. And so for our communities, most of us have grown up with these myths about pregnancy. And so the grandparents are the people that tell the myths because they're historically coming down from years and years of talking and training. So it's really a fun atmosphere. It's informative. It is a way that providers that you would never even thought of that would come together. In one of our showers, we've had a funeral home that came that promoted it. We've had lumber yards. We've had beauty shops, barber shops. We have all people within our community who's trying to get the word out about infant mortality, to raise awareness, to just come together and support an initiative because everyone wants healthy and happy babies.
Right, and sort of that whole community enveloped support system.
Yes.
So with this, and one of those myths is, I just know, is that if you look at a monkey while you're pregnant, the baby doesn't end up looking like a monkey, right? That's a big one that's been out there for a very long time, so I just want to clear that one up. So with that, with these community baby showers, then how are they organized with time? Is it a couple hours in the evening? Does it tend to be during the week, on a weekend? Do you sort of vary that based on what that community needs? How does that work?
It's the latter. It's based on what the community needs. Normally, because we're looking at low economic women, we try to have it during the evening time so that they're off work, they don't have to take off any work time, and they can bring their children as well. Okay. So it's normally, we've had some in the day, but most of the times we try to have them in the evening, and normally we try to have them on a Thursday evening because Wednesday is normally church, Tuesdays could be church as well, and so other people, they have other things that they've already committed to. So Thursday seems to have worked well for us to have the educational community baby showers on.
Okay, and again, I will put up information how to get in touch with you because the communities can reach out to you to say, yes, can you come to us and offer this baby shower? Because again, it's free of charge, yes, to all the participants in that community.
And all we ask the community to do is just to form a committee. And the committee is included in the toolkit. And so we provide technical assistance with anyone who is willing to host a community baby shower.
Okay, now do you do any follow-up with those communities in terms of sort of the effectiveness of those baby showers and outreach efforts and how those moms and those babies are faring?
We do evaluation on every shower. Every shower, participants do evaluation. We've started doing a follow-up within 6 months after the shower to see how effective it's been.
Okay, and so far the results have been pretty good. Are people really learning and beginning to make some of those changes that can lead to healthier babies?
We are just now looking at the 6-month increments.
Okay.
But from the initial evaluation, everything has been positive, that people have learned, have increased their knowledge of infant mortality. One of the things on our evaluation is, will I take a fact that I've learned from the baby shower to someone else, which is very important for us because there are some people who may not be able to attend the shower, but it's keeping that information in the forefront of their mind and keeping it in the forefront of their lives, because the more information you gather, the more informed you are, the better you're able to take care of yourself.
Right, and then having those resources, like you said, finding the resources to help support you through the pregnancy, and especially that baby during that first year of life.
We're looking for people to move more, be tobacco free, because you know tobacco has an impact on health. Right. And just basically take it incremental steps, one step at a time, because the more you think about your health and the more you do, the healthier you'll be.
Exactly. Thank you so much for joining me, and thank you for all of your work and initiatives.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/HealthAlertUSA. And remember, it does take a village to raise a child, so get involved, help each other out, pay attention to the needs of our moms, our dads, as well as our youth. Take care.